And we're live.
Yes, we are.
Wonderful. Let's give it a few seconds for folks to join us. I'm Dr. Anna Glezer, and with me here today is.
Dr. Malathi Acharya.
And it's wonderful to be here, the two of us chatting, and we'll share with the audience a little bit more about what each of us do, and then we'll really kind of dive into this topic from gut to brain, the untold story of mental wellness. And Dr. Malathi came up with that title, and I love it.
Yes, this is definitely the untold story so far, but the good news is that we are going to have more stories to tell as time goes by and as we have more research. And Dr. Glazer, I have comments that if the comments come up from our viewers, I will read it out and we will address them too.
Yeah, absolutely. And I think that, because we're also, in addition to having this live, we're recording this for anyone who's going to be listening to it. And I think there's a lot of really valuable content that folks are really going to enjoy, even if they can't make it live today.
Absolutely, yes. Yeah.
So let's just kind of start with ourselves and our backgrounds so that the listeners can learn a little bit more about us and why we're even interested in this topic. Would you like to go first?
Yes. I'm Dr. Malathi Acharya. I'm the founder of Ayur Integrative Medicine. I'm board certified. I'm a diplomate of the American Board of Integrative Medicine, and I'm board certified in internal medicine as well as hospice and palliative medicine. Integrative medicine is a multidimensional approach to health. It not only addresses the physical aspects of health and illness, but it also addresses the mental, emotional, and spiritual aspects of health and well being. And my passion is to bring it to the people in the Bay Area.
Amazing, amazing. And so I'm Dr. Anna Glezer, and I'm a reproductive and integrative psychiatrist. And the reproductive piece really refers to working with women across the reproductive lifespan. So it could be pregnancy, postpartum, perimenopause, premenstrual symptoms, whenever hormones play a role. And then the integrative piece really refers to, similar as what you were describing, where it's looking at treatments, including but also beyond conventional medicine. So including certainly traditional psychopharmacology, but also including all kinds of other things related to lifestyle therapy and other treatment interventions, all kind of working synergistically to help patients. So that's the integrative psychiatry piece. And I have a practice, women's wellness psychiatry, that serves patients across the state of California, as well as various teaching opportunities and learning opportunities for clinicians, like a psychiatry fellowship program in the field of reproductive and integrative psychiatry. So I'm excited to be having this conversation because there is such an important relationship in terms of that gut brain connection. And I think what we can do is dive into that a little bit further. So why don't we start there? Why don't we start with looking
I
at.
just want to say one thing before we start. Dr. Glazer, your area of expertise is so valuable for women in the most vulnerable times of their lives. I would say, the reproductive, your expertise in reproductive psychiatry and, the times when women goes through hormonal changes. I just want to call that out. I see that as such a valuable expertise that you provide
Thank you
for our
so
patients.
much. I appreciate that. And I agree with you that I think in general, these kinds of time windows are often under discussed and underserved. And so we definitely need to be having these conversations about holistic care.
Absolutely. Let's dive into our
Let,
discussion.
let's do it. Let's dive in. So let's kind of start with the big picture piece because so you're a lifestyle medicine internist, I'm an integrative psychiatrist. What is this relationship between physical and mental health?
So the whole concept of in integrative medicine is that health is not, we cannot segregate health as physical health and mental health. Actually, um, this concept holds true in other traditional systems of medicine, like traditional Chinese medicine and Ayurveda, which are centuries old. This concept is well established that you cannot separate physical health and mental health. Health is um, I would say one whole entity which has different dimensions. So in order for us to be physically well, we have to ensure that we are mentally, emotionally well also, and vice versa. So we cannot separate both. So there is and what we are learning with integrative medicine, and what's the central concept in integrative medicine is we want to bring that old wisdom back and apply it into the tradition Western system also, that they are all intimately connected with each other.
Absolutely. Yeah. And I think that's such a good point. And it's something that I share with my patients as well is, okay, integrative, right? Let's integrate all of the things. And so that might sometimes include integrating and collaborating with a Chinese medicine expert or an Ayurvedic practitioner, because all of these, more traditional forms of medicine can really help us address some of the disconnection that happens that leads to symptoms. So let's talk about this gut-brain connection. What is this connection? How does the gut and the brain connect?
Okay, so in order to understand this, I want to talk a little bit about gut microbiome. Okay, so our body has 100 trillion microorganisms. In fact, this is like this number is way more than about 100 times more than the genes in these microorganisms that we carry on our body is more than 100-fold more than our own genetic material itself. So you can imagine um, we call it microorganisms. Most of them are bacteria, but there are some fungi and other organisms also. Um, Most of it live in our gut, in our intestines, from the mouth to the anus. But we also know that our skin is another big organ that's colonized with the microorganisms, and we are finding out more and more about these microorganisms being present in other internal organs as well, and playing a role in our health and wellness. And these and our intestines by themselves are just not a digestive organ. Our intestines are complex um, interaction of muscles and nerves. So we have our brain and the central nervous system. We have our autonomic nervous system, which is the sympathetic and the parasympathetic system. And we have a huge another nervous system in our gut, in our intestines, which is called the second brain, or the enteric, or the gut nervous system. And there is two-way communication between all of these systems. The communication can be direct through the vagus nerve, which is the most important form of communication. And this communication can be indirect through the different chemicals that are secreted by these microorganisms. And the communication is from top down and bottom up. So, the way our emotions and what we are feeling, the stress, can have a direct impact on our gut microbiome and the functioning of our intestines. And the functioning of our intestines can affect our physical and mental well-being.
And what is the role of inflammation in all of this? I think we hear so much about inflammation these days. What is the role of inflammation in all of this?
Inflammation is any reaction to something that's not normal in the body. It's a stressor. Inflammation can be a direct response to microorganisms invading, infections. That's one thing we commonly know. But inflammation can also happen from certain unhealthy things that we ingest through diet. Okay, so those can also set off inflammation in our body. Definitely the stress, our stress response, we experience a lot of external stresses, and that triggers our internal stress in our body, and the stress response also triggers inflammation. And inflammation causes, and another thing is lack of sleep, not moving adequately, not countering our stress response, lack of sleep or unhealthy sleeping habits, all of it can trigger inflammation. And inflammation in turn sets off a cascade of responses, unhealthy, unwanted responses in our body, that can lead to things like heart diseases. It can lead to atherosclerosis in our blood vessels. It can lead to depression, anxiety, as you very well know. It can lead to insulin resistance, and the consequential pre-diabetes, diabetes, weight gain. It can lead to a cascade of responses. So inflammation is something that is we have to be aware of. We have to take steps to counter it, because it's going to lead to a lot of negative consequences for our health and wellness.
And so let's look at that a little bit, just to kind of turn for a moment to some of the practical tools, right? Because if we're talking about this gut-brain connection, which is mediated by things like the vagus nerve, the microbiome, and inflammation that we just talked about. So if someone is struggling with symptoms of physical illness and it's also manifesting as mental unwellness, disease, what is that connection about? Let's talk a little bit about how physical symptoms can be a manifestation of mental unwellness, and how mental symptoms can also be a manifestation of gut and other physical ailments. And then we can get into the practical of, okay, how do we address it? How do we fix some of these challenges that folks might be having?
Sure. So for example, we know that in order to let's talk about nutrition. Okay, so we know very well that certain eating nutritious food is important, not only for our physical health, for our mental health, because we have enough studies to tell us that eating refined and processed foods, especially simple carbs, processed carbohydrates, refined sugars, they not only cause the physical consequences, but they also affect our mood. Okay, so there is some way that whatever we do, a consequence of whatever we do in terms of diet, lifestyle, sleep, movement, or stress, lack of stress management, they have direct consequences on how we feel, and how and physical symptoms also. And some of this may be and I think a lot of this has to do with how these foods go inside our body, how they affect the gut microbiome, how they affect the balance of the chemicals, the good and the bad chemicals that they secrete, and how those things then consequentially go to different parts of our body and cause the effects. Okay, so so by changing our diet, by focusing on foods that will promote the healthy bacteria, we can in turn expect to have an improvement, in a balance in our an improvement in how we feel mentally as well as physically. Now, stress. So, for our gut to function normally, we need a good balance of sympathetic and parasympathetic stimulation, because the sympathetic stimulation um, does not favor digestion and absorption. So when we are under stress, and we know that under stress our sympathetic system gets stimulated, the gut pretty much shuts down because we need to deal with the body's stress response. So that doesn't favor digestion. So in in this environment, the modern days where we experience a lot of stress and we don't do enough to when we are not able to put in practices to counter the effect of the stress. So we know that there is a sympathetic overactivity, there is less of parasympathetic system, and this affects the way our gut functions, and this affects the health of the bacteria there, and has widespread, loop back effect on how we feel. Does that make sense?
Absolutely. And I think just kind of going back to that to the gut that still needs healing. I think one term that often I hear that I think a lot of our patients are also struggling with is this idea of leaky gut, and what is that?
So one other important function of the gut microbiome is to act as a barrier. So it has if we have the right type of bacteria, if there is a most of the bacteria that we have are the protective favorable bacteria, then they work. The substances that they secrete, they secrete substances called short chain fatty acids and other things which are protective for us. So they make the gut barrier tight. They don't allow toxic substances to get into our body and have effects. On the other hand, when our gut microbiome is not healthy, when we have not when our diet has not favored the growth of good bacteria, when there is a lot of stress, when there is an imbalance in our life. I see that Dr. Glezer is not in our room. I'm going to troubleshoot for a minute here. We
And we're
apologize for the inconvenience.
apologies for that. I am in a internet drop off prone zone, so I do apologize for that. We're back.
We're back. Okay. So so we were talking about leaky gut. So when things are not healthy, when the balance is not optimal in our in our gut, so the gut microbiome is not, these bacteria are not able to act as a protective barrier, and they're not able to secrete the other substances. So the toxins and other things that we ingest, or the bacteria that we come across so much, the different microorganisms we encounter in our life so much every single day, our body takes care of a lot of it without us even feeling anything. These things then start acting up, and sometimes when there is a change, the composition of the chemicals that are secreted change when there is a disturbance in what bacteria are more dominant and what bacteria are not. And they also make us more vulnerable to infection. So there's a lot of research going on that is shedding light on a lot of things. So yeah, they do also, gut bacteria also form a very strong barrier protecting our body against external influences.
Yeah. Yeah. So let's go to the practical. Let's turn to the practical now in terms, because we've talked about the things that can go wrong and how they might go wrong. So let's think about ways to rectify that a little bit. And I think, we've touched on this a little bit in terms of thinking about, the role of nutrition and sleep, to help manage, for example, inflammation, which in turn is going to help manage symptoms related to, to mental challenges. So let's talk about each of these in turn a little bit. Could you share with us a bit about, the role of sleep and how that mediates inflammation and physical and mental wellness, and how we can improve that?
Absolutely. So, just to digress a little bit, if in terms of interventions and what we can do, I would divide it up into nutrition. I would divide, attention to sleep, stress management. So those are, very three important pillars. Um, and I'm jumping into what you asked about sleep. Now, what we are realizing more and more is that um, circadian, we need good restorative sleep to be healthy, and this also directly um, and by that I mean it directly refers to, if we want our gut microbiome to be healthy, we need to make sure that we have good restorative sleep. Somehow the circadian rhythm, keeping awake in the daytime, sleeping with darkness, and maintaining the circadian rhythm is important for the health of our gut microbiome. And we also know that sleep helps us, having had a good sleep in the night helps us deal with stressful situations much better. Our brain is less reactive and more able to stop and think rather than be reflex and reactive. So sleep is, very, very important.
And so, what are some practical ways that we can think about improving the sleep of our patients?
You know, Simple things, having a good and consistent sleep ritual, bedtime routine is very, very important. And the key thing about this is going to bed at the same time and waking up at the same time every day, and that in accordance with, the circadian rhythm, the cycle of light and darkness, because that is what our body is primed to, respond to. There are, receptors, everything in our body is primed to wake up with exposure to light, and primed to shut down with, as light goes down and darkness sets in. And so we have to respect that circadian rhythm. So, setting up a consistent sleep routine, being very judicious and avoiding stimulants, eating a healthy, nutritious diet, because if we consume food substances that are not very healthy, that our body is not able to handle properly, then it causes bloating, in discomfort that can also affect our sleep. So being, paying attention to nutrition, having enough movement and activity during the day, that sets us up for a healthy, good restorative sleep. That's important. And also, here is the key thing about sleep is, our brain needs a wind down period before shutting down for sleep, because there's so many things that we deal with during the day, and there's so many stressors that we are responding to, that all of a sudden one cannot expect to go to bed at 10 o'clock, close your eyes and expect to fall. So giving ourselves a consistent, calming wind down routine is very important, which could be and then blue light exposure, of course, everybody knows about it. I mean, it's blocking the blue light, allowing our brain to kind of naturally start shutting down, having a transition period from the intense work we do with our screen and other things. A calming routine like meditation, or a warm lemon balm tea or something like that, that calms you down and also tells our brain, okay, hey, the lemon balm tea is here, so it's time for me to start thinking about winding down and going to sleep. and a good, you know, either a breathing, a relaxing deep breathing exercise or a good meditation. Either you can do it yourself or several guided meditations, especially several guided meditations to help go to sleep. It, that starts triggering our relaxation response. So it switches us from a mode of stress to a mode of relaxation. All that will help, towards us going to sleep and achieving a good restful sleep.
Absolutely. And I
Do
think,
you?
I mean, those are all really good examples of, a healthy sleep hygiene routine. And I think the other piece is, for folks, I mean, there's entire courses and a lot out there on sleep. And so I think the other thing is, for folks who might be struggling with sleep, to think about, what else might be impacting sleep outside of some of these sleep hygiene tools, and working on making sure that potentially undiagnosed conditions, whether it's sleep apnea
Absolutely.
or restless legs and those kinds of things, are well treated before making any other kinds of interventions. And so you had mentioned, basically you had mentioned sleep, nutrition, and stress as kind of some of the cardinal places where we can intervene. We've talked about sleep. We've touched a little bit on nutrition. Maybe we could dive a little bit more into that, as well as that final piece of stress.
Right. So, in terms of nutrition, the good news is this, okay? We don't have to remember five different formulas of, or types of, that we need to, oh, this nutrition is, this type of food is for my cardiovascular health. This is for my mental health. This is for my gut microbiome. The good news is that it's all the principles are all the same. So, um, the key things are, including a lot of colorful vegetables and fruits that have plenty of plant nutrition. We call it phytonutrients that have so many uh, beneficial substances that help our body in a natural way. So if I have to say a few points, one is including a wide range of colorful vegetables and fruits in our diet. You know, 4 to 6 servings a day is very important. Avoiding processed and refined foods. That is very key because processed and refined foods are a key trigger of inflammation for us. So, avoiding processed and refined foods and refined sugar, um, including whole grains. Whole grains in our diet is important. Um, Refined grains are grains where the husk or the covering has been removed. They have lost a lot of micronutrients that are vital for us, and they've just retained the carbohydrate part. So, you know, the refined grains are not a good source of nutrition, but rather whole grains. Of course, there is a lot of focus now on plant-based, lentils and pulses and protein, because there's a lot of studies that show us that animal-based foods do cause inflammation. So, a lot of healthy proteins, healthy fat, healthy like, olive oil, canola oil, nuts. So, and including a lot of fiber in the diet. So a lot of fiber, because the fiber is the food that the bacteria, the good bacteria in our gut, like the fiber, and they thrive with a lot of fiber. So if we give it food that it likes, we are going to have a lot of the good bacteria sitting in our bodies rather than the bad ones. And it's good bacteria kind of dominate and prevent the multiplication of the bad disease causing bacteria. So fiber in it. So paying attention to our diet is important. Also meal times, not eating too late in the evening, allowing a period of about 12-13 hours of fasting overnight. All of them, these contribute to our metabolic health. We talked a lot about sleep and stress management. So there is a, as I mentioned earlier, our sympathetic and parasympathetic systems have to be balanced. We have an overdrive of sympathetic nervous system from the stress of modern life. So we have to make sure that we simple tools that, trigger our relaxation response to counter the stress, so that we allow our gut to function somewhat normally, to digest and absorb our food and do what it's supposed to do, like protect us. So simple tools are that trigger relaxation responses are breathing exercises, mindfulness practices, um, you know, just doing something enjoyable, connecting to nature, taking a walk, or spending 5-10 minutes doing, it could be doing nothing, but something that gives us the calm and the quiet and the space. These are all some simple tools you can do to trigger our relaxation response.
And I like that you started to talk to us a little bit about, fiber as an important prebiotic. One of the things that I think a lot of folks ask is, what about various kinds of supplements like probiotics and prebiotics for gut health and then consequently mental health? Can you tell us about the role of that?
Okay, so prebiotics are foods that prebiotics we know are very helpful because they are the foods that the gut bacteria feed on, and they cause a lot of beneficial effects. With respect to probiotics, we know that there's a lot of preclinical trials going on that are looking at specific strains of bacteria and the effect that it has in helping with our mental health and other aspects. So there are lots of preclinical trials, but the thing is that we don't have any hard evidence yet that we can start recommending specific strains of bacteria. There is this new term called psychobiotics, that are looking into specific strains of bacteria that can help with mental well-being. But the we are hopeful that there's going to be more research and information, but as of this point, specific guidelines are not there yet.
Yeah. Yeah. So definitely some areas where additional research is still pending.
Yes.
What else should we talk about in the context? I mean, we've talked about these three important components, nutrition, sleep, and stress in terms of, healing the gut-brain connection, helping us with physical and mental health symptoms. What else do you think we should mention that we haven't yet mentioned in this particular context?
I think we covered the key aspects of what this is. I can't think of anything else. Is there anything that you would like to add?
No, I think we've covered a lot actually of the background and some of the practical takeaways for folks who are listening and might want to have more of an in-depth conversation. Maybe we could share a little bit about where to get additional information and consultation and assistance.
Absolutely. So you can find me at my website, www.ayur.today. I also have recordings. I have a YouTube channel, so you can subscribe that for my website, where I have more information on different topics integrative. And Dr. Glezer, how about yourself?
Yes. So I have a clinical website, which is my name, AnnaGlezerMD.com. And then for any clinicians who want to kind of learn a little bit more in depth at the interface between reproductive and integrative psychiatry to help our patients, there is an online course, which is psychiatryfellowship.com. So please feel free to reach out to me through either mechanism. And then, of course, there's other resources and tools like the Women's Wellness Psychiatry podcast, mindbodypregnancy.com is a blog. So a lot of different places to get help and to get some more information.
Fantastic.
So I'm glad we had the opportunity to do this today. For those who weren't able to join us live, we will definitely have a recording of this conversation, and we will continue to talk about this.
Fantastic. It was wonderful conversing with you, Dr. Glezer, about this topic, which I'm passionate about. It's a relatively new field, but lots of wonderful information coming out, and I'm glad we had this opportunity to talk about this. And for those of you who were able to join us, thank you for your time, and we will have this recording available for those of you who weren't able to join.
Wonderful.
Have a lovely rest of the day and a great long weekend.
Yes, thank you so much, and you as well.